Today I will be demonstrating how to assess the flexibility for straight leg raise, the Canadian trunk forward flexion, YMCA sit and reach test, and lastly the chair sit and reach test. Before performing any of the flexibility assessments, a 5 to 10 minute warm-up is required at moderate intensity. The straight leg test assesses the flexibility of the hip flexors. These muscles tilt the pelvis posteriorly, and any disproportion between these muscles and flexors can negatively affect the lower back. For this test, you will need a goniometer, a tool used to measure the angle and range of motion, and a mat to lay on. Subject must lay supine or on their back. Next, you will want to lift the client's right leg while ensuring the left leg stays extended and flat on the floor. Now you will place the goniometer at the greater trochanter to measure the angle of flexion. Repeat this measurement twice on the right leg and the left leg and record the angles. 90 degrees is a desirable angle and 80 degrees is the minimum angle that is acceptable to pass. Anything less than 80 degrees is unacceptable. The Canadian sit and reach test assesses hamstring flexibility. For this test, you will need a flexometer sit and reach box at the 23 centimeter mark. The client will sit without shoes, back straight against the wall, with soles of the feet flat against the flexometer. The inner edges of the soles are placed within 2 centimeters of the measuring scale. Have clients' hands be parallel to each other with fingertips overlapped. They should not be leading with the other hand. Client must reach forward with both hands as far as possible while exhaling and dropping their head between their arms. Make sure client holds for 2 seconds. Legs should be extended but not pressed down. 2 trials are done for this test, and the most distant score is the one that should be recorded. You can refer to the norms table to see what category you land in. This chart uses the flexometer that uses 26 centimeters, so you will subtract 3 since we are using 23 centimeter flexometer when looking at this table. The YMCA or V-sit and reach test assesses hamstring flexibility. For this test, you will need a yardstick, tape, and a ruler. To measure 12 inches of the tape, the yardstick is placed on the floor with the tape placed at the 15-inch mark. Client will sit barefoot up against the wall with yardstick in between their legs. Legs are extended 12 inches apart with heels touching the edge of the tape. Client will reach forward with both hands parallel, making sure one arm is not leading with the other. Client will exhale when leaning forward as far as possible. Make sure client holds for 2 seconds. Client must touch the ruler when reaching and not bounce. 2 trials is allowed and the best reach is recorded. You can also look at the norms table to see what category you land in. Chair sit and reach test is for older individuals 60 years and older. For this test, you will need a chair 17 inches in height and a ruler. Place chair against the wall so it doesn't tip over during the test. Client will sit at the edge of the chair with one leg extended. He will be on the floor with a dorsiflexed ankle. The other leg is flexed flat on the floor. With the extended leg as straight as possible, client will reach forward with hands overlapping, making sure one is not leading with the other. Keeping their head in line with their back, make sure head is not tucked in. As client reaches, she must exhale, reaching as far as possible and holding for 2 seconds. Once client has reached as far as possible, place ruler parallel to the leg and record the score. Client is allowed 2 trials on each leg. Aiming for the toe but going further is always the best, and this is a positive score. If client cannot reach toes, this is a negative score. As always, thank you for watching.